welcome back to the show. MetroPlus Health has recently announced a campaign to educate New York City employees on their choices when selecting a health insurance plan. Now, the campaign supports MetroPlus Health's ongoing commitment to providing affordable and quality health insurance to New York City municipal employees, as well as non-Medicare eligible retirees, qualified domestic partners, and eligible dependents. And here now to share a little bit more is the Chief Growth Officer at MetroPlus Health, Roger Milliner. And Roger, good to have you.
Thank you for having me.
Hey, glad to have you. Now, when we talk about affordable health, I mean, really, affordable health insurance is that today is really paramount in the lives of so many people. And I know that you guys at MetroPlus Health are really working to make sure that people can become educated when it comes to having a health insurance plan. So, talk to us a little bit about your campaign.
So MetroPlus has been a healthcare provider of insurance for New Yorkers for over 35 years. One of our most proud programs is our program for city employees. This is the fall transfer period where city employees have the ability to join health insurance plan for the first time, change their healthcare coverage. So we're launching a big campaign to promote all of our additional products and services that we're offering to city employees and to make sure that city employees know their options.
Yeah. And so there is what's known as that enrollment period. But for somebody who may not be so familiar, walk us through exactly what is the enrollment period?
So it's known as the fall transfer period. That's the time where any city employee who currently works in any of one of the city or mayoral agencies has the ability to change their health coverage. Usually you're in a health plan for about a full year, but you make changes in the fall transfer period or the open enrollment period. So from November 1st to November is the opportunity for people to change health insurance plans. And this is known as the open enrollment period. So we're actually in the enrollment period now, the fall transfer period. This is a great time for New York City employees to start looking at what they like or don't like about their health insurance. What is it covering? Changes do I want to make? Is it affordable for me? So now's the time to really look at your options. There's about 13 different options for employees to choose from. MetroPlus is the best option for people to choose. We're a very low cost plan. There's no payroll deduction if you want the basic plan. However, if you do want the option rider that gives you additional dental and vision services, then you would take the option rider. But the basic plan with no option rider is free. There'll be no payroll deduction.
And so for you, you also have a plan that's really dedicated towards city workers. And I know that's called the Gold Plan. So educate our viewers a little bit on the Gold Plan that's available, because we do have some city workers out there. Let them know what's available.
So MetroPlus Gold is a product specifically designed for anybody who works in one of the city agencies or mayoral agencies. This offers you a really, really cost-effective plan that has no payroll deduction. So I said there's nothing coming out of the check on a biweekly basis if you get paid biweekly. So it's totally free. There is no co-payments whenever you go to your physician. So you don't have to worry about that added burden of having to out of pocket for a copay when you go to the doctor. There's no co-payments at your specialist. So whenever you go to a specialist, you can rest assured that you don't have to come out of pocket and worry about any out-of-pocket costs. So no payroll deduction, no cost at your PCP, no cost at your specialist. Some city employees who are not unionized and they choose to take the rider for their prescriptions, they will have a very small copay, a small deductible coming out of their biweekly paycheck. We have the lowest option rider for anybody who needs that option to get their prescription drugs. We do go to the pharmacy, it's only $5 for your generic or brand name drugs. So it's a really affordable program. It offers access to over 3,400 providers throughout the city of New York. We have a very robust hospital network, which is inclusive of over 40 hospitals in the 5 boroughs of New York City. We have tons of specialists. We have people who would want to go to large multi-practice facilities. We have those in our network. We have a ton of urgent cares, and we actually added more urgent care centers to our network recently. So the network is really robust.
So talk to us a little bit about what's going on right now, because we have a new mayoral administration getting ready to take place in New York City. Has elected Eric Adams to be the next mayor of New York City. What does that mean, do you think, from your perspective for healthcare and how things work for city workers?
One of the most important things that Eric Adams ran during his campaign was to really eradicate this COVID-19 pandemic. We've seen that the COVID-19 pandemic showed that there was a lack of coordination between healthcare providers, which is critical. It creates inefficiencies, inequities within our healthcare system, and it costs lives, and we've seen that. So one of the most important things I know coming out of his campaign and as part of his agenda moving forward is to make sure we really tackle COVID-19 and make sure that there's coordinated care amongst the healthcare providers in the system in New York. He has a plan to build the city back healthier. He wants to have a healthy city that defends COVID-19 and improves the healthcare for city workers, for all New Yorkers, basically. And some of the main points I would say is that we need to close this racial, healthcare gap that we have. We've seen that certain communities were affected more than others. And so that's on the agenda to bring equity amongst the healthcare system in New York. To form a united hospital system. Even though Health and Hospital is the city's own hospital system, at times it's been disjointed. And his plan is to really unify a citywide hospital network. I know also that he wants to improve preventable care and teach healthy habits to make sure that New Yorkers are living healthy. And this is all good because MetroPlus is at the center of this plan. We are the City Health Plan. MetroPlus is a subsidiary of the New York City Health and Hospital System, which is the city's hospital system that Eric Adams would be the mayor over this agency. Other key points where I think MetroPlus fits in well is that he wants to strengthen the safety net hospital system, expand on COVID testing and resources, prevent healthcare inequities in underserved communities, treat social issues. MetroPlus has a lot of specific programs through our social determinants of care model that perfectly in line with the incoming mayor's desire to treat social issues as part of the healthcare system, because often social issues were treated as a criminal issue or something like that. But now he wants to bring that in and have it treated as part of the healthcare system. I think MetroPlus aligns well with that. He wants to expand on telehealth, and MetroPlus has a great telehealth program. All through the pandemic, we really serve people well when they have the ability to go into a healthcare setting, and telehealth was heavily used. So our telehealth program proved one that was very important during the pandemic, and he wants to expand on telehealth services.
Well, certainly we look forward to seeing what happens with the new mayoral administration. And we know that Metro Plus Health is very connected to taking care of city workers. And Roger, I want to thank you so much. He's Roger Milner is our growth officer, chief growth officer at Metro Plus Health. And Roger, thanks for joining us.
Sure.
Want to let people know if you want more information, please visit them on their website, metroplus.org, and then also follow them on social media at MetroPlus Health. We do have more show. Don't go anywhere. Open continues coming up right after this.